Okay, so part 3 here, scleroderma. It's, as I said, it's a complication of the of autoimmune disease. And kind of the first level of involvement is this Raynaud's phenomena related to the skin that I've already talked about. If you have other organ involvement, there is an acronym CREST, so you can look that up and see about that. Really, there's nothing, you can't really treat this disease or this illness complication. So what you do is you treat the underlying disease and you treat the symptoms. There's not really a way to cure this illness. And you can see some of the medications that they use to treat the symptoms. So degenerative joint disease, DJD, is a non-inflammatory joint disease. It's basically just, it's not an autoimmune issue. It just affects the specific joints. It's not a systemic thing, and it's not an autoimmune issue. It's basically predominantly a function of wear and tear, usually age-related, although, you know, people who are using their joints a lot, you know, sports people may have the issue of DJD at an earlier age. So signs and symptoms are pain, stiffness, it's worse with movement or exercise, and improves with rest. It can be apparent in the morning when you first wake up, but it usually resolves quickly, which is different from rheumatoid arthritis, and that's important to remember. Treatments involve, you know, treating the pain with acetaminophen and opioids, and also corticosteroids can be helpful. When you know, surgery is indicated when the pain and the degeneration reaches a point where it is considered severe. So you can have an osteotomy, which is where they kind of go in and alter the distribution of the weight in the joint, or you can have an arthroplasty, which is where the joint is actually replaced. Some of the nursing considerations have to do with pain management, referrals to OT and PT for additional therapies, and various assistive devices. Fibromyalgia, myalgia, is a chronic pain syndrome, which is a function of the functioning of the CNS pathways that regulate pain. They are not functioning properly, and it's a good analogy has to do with volume control. Like if you were to think of a volume control setting being constantly set on high, that's kind of a good analogy for what fibromyalgia is. Treatments are generally with NSAIDs, tricyclic antidepressants, which is an adjuvant, and basic sleep hygiene, so those therapies that can help with sleep, and also alternative therapies. The issue with fibromyalgia is that it is a chronic pain syndrome, and it's nonspecific, has these generalized symptoms, and it's often not taken seriously, and nurses need to be supportive and non-judgmental and provide the a non-judgmental and therapeutic response to these patients. So let's move on to Chapter 71, Infectious Diseases. And in this chapter, it initially goes into the chain of infection. This is probably familiar, or should be familiar to you. You just need to have a general familiarity with how this works. Infection control, I want you to be familiar with the different types of control precautions, you know, standard precautions, airborne precautions, etc. And this is in Chapter 1 or 71, and I want you to be familiar with those. The next area are the healthcare associated infections. These as you can see, some of the statistics related to HAIs. The three top ones are C. diff. This is a spore-forming bacterium, and it usually follows antibiotic treatment, set therapies, because what happens with antibiotics is that the normal intestinal flora is destroyed. This is a very virulent illness, and it's because it's antibiotic resistant, obviously, and it's also resistant to disinfectants. So places where this bacterium can end up on equipment, surfaces, hands, it can be remain there, and what's necessary is that you need to use bleach-based disinfectants rather than alcohol-based disinfectants. So hospitals will have, or facilities will have a different kind of cleanser to use for disinfectant because of this issue. MRSA is another one that we're all familiar with, and this involves Staph aureus, which is easily colonized on the skin, and the patient can become a reservoir. It's was more of a problem in the past. It's on the decline recently, and this is because of improved infection control measures. There is also a worry with community-associated MRSA, and this is a different strain, involves different strains of Staph aureus, and this can occur in different community settings, in places where there are children, daycare settings or sports teams, prisons. We've all heard of that, and this it is necessary to use contact precautions for MRSA. VRE, this involves the Enterococcus, which is a gram-positive, a normal part of the GI flora, and if it's introduced into the blood or wounds or urinary tract, it can cause significant illness. Its virulence is due to it being antibiotic resistant. It's also bile resistant, and it persists on the hands of healthcare workers and equipment and objects. There are also problems with multi-drug resistant gram-negative organisms, and this is on the rise. So another infectious disease that is a concern is those that are diarrheal. There can be a lot of different causes, so what's important about these types of illnesses is to identify what the cause is so that you can effectively treat it with an appropriate, either an antibiotic or whatever is causing it, finding the correct treatment. I know that on 4 North we had a patient who had a GI illness, and it was being followed by infectious disease doctors, and they had ruled out a lot of different issues and tracked it down to a possible illness that came from South America, exposure to a particular raw milk that she had while she was down there. Anyway, some of the issues with these kinds of diseases, as you can probably figure out yourself, hydration is an issue with these patients. So if you have an already vulnerable patient, either a baby or an elderly person, this can become quickly very serious. Electrolytes is also a problem if you have diarrhea. Hand hygiene is absolutely critical. Prevention of complications, bacteremia, hypovolemic shock. These are serious consequences of this kind of illness. And so, again, you have to be aware of vulnerable populations. So, our last kind of infectious diseases are sexually transmitted diseases. 2 or 3 main ones are syphilis, which is caused by these 2 bacterium. There are definitely stages to syphilis: primary, secondary, and tertiary. Initial signs and symptoms can be just a painless lesion called a canker that resolves, so it can be very subtle, and if a person is not paying attention, it can become asymptomatic, and it can become very serious if it's not treated. Diagnosis is through serologic tests. VDRL or RPR-CT are two of the tests that are used to diagnose it, and it's treated with antibiotics. It's easily treated with antibiotics, but the tricky part with syphilis is that it can go undetected. So people who are sexually active need to be aware of this. Two others types of sexually transmitted diseases that often go hand in hand are chlamydia and gonorrhea. These are the most commonly reported infectious diseases in the U.S., and as I said, they often occur together. In women, these illnesses can often be asymptomatic and can lead to other more serious complications such as PID, ectopic pregnancy, endometritis, and infertility. I don't know if that's endometritis and infertility. With men, it can be symptomatic, but often it also is not symptomatic, and if they do have symptoms, it can be burning or a discharge from the penis. And again, it's important that these illnesses be treated, because you can be passing it on to other people. Nursing considerations for sexually transmitted infections is that there must be a mechanism to report these illnesses to the health department, because other people can be affected. And the other side of this is that the partners need to be notified. Education is important in prevention. Protecting confidentiality is also extremely important. You could get into a lot of trouble if you don't do that. And it's also ethical issue. And don't assume or judge, important to assess. And on page 2108, you will see a section called the 5 Ps, and these are what is to be considered when you're interviewing people that may have sexually transmitted illnesses. And that is the end. Thank you.